Hi, Dr. Madeline here from Forward Spine Center, and today I am at Revival Physical Therapy and Wellness here in Golden Valley with Dr. Maggie. Thanks for chatting a little bit, and we're here to talk a little bit about pelvic floor therapy. If you're thinking about having a child, maybe you've recently had one, or you're just transitioning into menopause, your pelvic floor matters, and it's often overlooked. So today we're just going to talk a little bit about the importance of pelvic floor, and as a chiropractor working with patients, the combination of chiropractic and physical therapy can be so important with any stage of life for women. So today let's just kind of ask some questions. And
I love it.
Can you share a little bit about what pelvic floor therapy actually involves and why it's important to women, not just postpartum, but all phases of life?
For sure, yes. So everybody has a pelvic floor, so it is super important. I work with people, like you said, who've had kids, who have never had kids, and sometimes problems just arise. And so a lot of the common things that I see are like urinary leakage, pelvic pain, pain with intercourse, even sometimes low back pain. The pelvic floor can play a part in, creating that low back pain. And so it's really important to address that. And so what we do here is, we assess what the pelvic floor muscles are doing. We take a look at, the full body and figure out, what might need to be strengthened, what might be holding a little too much tension, and then giving you some really actionable things to do from there.
Yeah, and can you explain like a little bit more, like, it's not just people who just had babies.
Totally.
That can benefit with pelvic floor.
Totally.
You see patients preconception to even menopause. Like how can someone transitioning into menopause, how can their pelvic floor benefit?
Yeah, absolutely. So as we are going through these different stages of life, especially transitioning into menopause, our hormones are changing so much, right? We have a big kind of progressive decline in estrogen, and so that affects all parts of our body, but including our muscles. And so it really will also affect, the muscles, the way that, the elasticity of the muscles, the ability to engage the muscles. And so we're really wanting to make sure that either we're, being proactive and kind of trying to prevent any issues, or we're addressing them and finding ways to give comfort to people.
As someone who specializes in maternity, I send a lot of patients out for physical therapy postpartum. Yeah. When is the earliest that you see someone?
Totally. So I will see people postpartum as early as 2 weeks after. And so that is just a nice way to kind of check in and see how mom is doing, see how the mom-baby relationship is going, if there are any, things that we need to address, whether it is, positioning while breastfeeding. I take a look at, any incisions or, the vagina, if it's a vaginal birth, just to make sure that things are healing well, answer any questions that moms have, and just give them some things that, can give them a little bit of relief or kind of help get them back on track.
And do you treat patients also during pregnancy?
Yes, all throughout pregnancy. It's kind of a balance, right? For a lot of people, they want to stay active, whatever that looks like, whether it is, going for walks, going to work, working out. So keeping people active and hopefully, not experiencing pain or limiting any symptoms that they have. And then we kind of transition into more birth prep. So getting ready for childbirth, whatever that looks like. And so that's one of my favorite parts of my job, is just helping people, prepare for this huge moment in their lives.
For sure.
Yeah.
For sure. So if someone is new to pelvic floor therapy, what can they kind of prepare for, or kind of know what's going to happen during that first appointment?
Totally. Yeah, really good question. So what we do is the beginning of the session, we'll just sit down together like you and I are right here. And I want to learn more about, the patient. I want to learn about what they're experiencing, any symptoms, and kind of just the history of, what they've been going through. Then we'll do a movement assessment. So taking a look at kind of the full body and seeing how they're moving, look at strength, range of motion, coordination, things like that. And then we'll do the pelvic assessment. So that can look a number of different ways depending on, the comfort level of the person. But we can do like the external pelvic floor assessment, so taking a look and feeling the muscles from the outside. We also do an internal assessment for those who, are comfortable with that. And what that looks like is it's just, one finger into the vagina, and that allows us to assess the internal pelvic floor muscles, and it gives us a lot of great information. And then at the end of the session, we sit down again and we go over, okay, this is what's going on. This is the plan to make these changes and start feeling better. And then we kind of go from there.
Awesome. And then how can someone get a hold of you, schedule? What's the easiest way to reach you?
Yeah. Well, from our website, of course, there's a lot more information there. If people are wanting to read a little bit more or seeing if they might be a good fit, they can schedule a free 15-minute call with us where we can talk through, what they're experiencing and make sure that, we're a good fit for them. They're a good fit for, someone who we see. And then that's just a nice, really easy introduction too.
Well, thank you, Dr. Maggie.
Yeah,
and if
thank
anyone
you.
has any questions, feel free to reach out. It's not going to hurt, and it can really help transition any phase of life.
Absolutely. Thank you.
Dr. Madeline here, thank you for allowing me to be part of your health journey.